Yeah. I mean, it's like so faint. There's.
You guys can't hear?
I could just heard what you said, but I can't hear.
You don't hear the video?
No, I mean it's super faint.
Uh, I'll send a link out after
Okay.
so y'all can get it. You don't want to see that one.
They're gonna send out a link to the video afterwards.
Oh my goodness.
They're gonna send a link out afterwards to watch it.
Nothing working for me today.
Gotcha.
There we go. Oh my goodness. Okay. Sorry about that, guys. I will send out a link to the video afterwards.
Okay.
And if you don't get the link, email me. My email is lester.brantley@bdh.virginia.gov. It's just a YouTube video, about 3 minutes. But we'll go over overview of the department as well, just giving you some of the agency leadership names and everything. Starting off with Dr. Marissa Levine, who serves as our State Health Commissioner and leads our agency. She coordinates our emergency preparedness and response efforts and provides leadership for the Commonwealth's public health system. Doug Harris serves as our adjudication officer to the State Health Commissioner. He makes recommendations on regulatory matters and serves as the agency's HIPAA privacy officer and the agency's designated records officer for record retention. If you don't mind, if you could put your phone on mute until you have a question. If you have a question, then chime in, please. The Director of Public Health is John Ringer. He's the Director of Public Health and Planning and Evaluation. He coordinates the development and implementation of the agency's strategic plan and oversees the public health accreditation process. Joe Hilbert is the agency's legislative liaison, regulatory coordinator, and FOIA officer. He leads staff to the State Board of Health. Alvy Edwards serves as our Director of Internal Audit. Internal Audit works with the leadership to evaluate the effectiveness of operations, compliance with policies, procedures, and performance, and the agency's strategic goals and objectives. The internal audit assists management in identifying and resolving issues and risks before they are identified by external auditors and other stakeholders. Internal audit also investigates allegations of fraud, waste, or abuse. The Director of Office and Information Management is our Chief Information Officer, Debbie Condry, who is responsible for ensuring that VDH programs have secure technologies, applications, and data. The Division of Vital Records is part of that Office of the Information Management. It is responsible for creating, certifying, and issuing Virginia's vital records. Dr. Hughes Melton serves as our Chief Deputy Commissioner. In the role of he serves as the Chief of Staff of the Deputy Leadership Team. When Dr. Levine is out of town or unavailable, he serves as our State Health Commissioner. Dr. Melton oversees many offices at VDH, including the Office of Risk Communication and Education, which coordinates emergency preparedness and response communications and training and education programs. He's over the Office of Emergency Preparedness, ensures that the VDH plans and prepares for effectively responds to and ultimately recovers from emergencies impacting public health and the Commonwealth health system. The Office of Emergency Medical Services provides pre-hospital patient care to the citizens of Virginia from the moment a call is received at 911 centers to the time a patient arrives at the hospital. The Office of Licensure and Certification ensures that the quality of health care delivered by providers is safe, cost-effective, and compliant with state and federal laws. The Office of Chief Medical Examiner investigates unexpected, violent, and suspicious deaths to determine the cause and manner of death. They use information from death investigations, fatality reviews, and surveillance projects to create reports about how and why people die to guide public health policies to prevent further death and injury. The Office of Environmental Health Services oversees several programs, including food safety, milk safety, bedding and upholstery, childhood lead prevention, campground regulation, and hotel and pool surveillance. The Office of Radiological Health is responsible for protecting the public from unnecessary radiation exposure. They regulate radioactive materials, register, inspect, and certify X-ray machines, monitors environmental samples near nuclear facilities, and provide education and technical assistance for indoor radon hazards testing and mitigation. The Office of Drinking Water implements and enforces the drinking water regulations and standards. Staff in this office routinely issues permits, performs inspections, monitors drinking water quality, provide technical assistance and training to drinking water system owners and operators. So the Deputy Commissioner for Administration is Richard Corrigan. He oversees several offices, including the Office of Financial Management, which performs accounting and cash management services for the agency. The Office of Purchasing and General Services, which ensures that all materials, supplies, equipment, and services that we need are purchased at a competitive price. The Office of Human Resources, which provides consultation and guidance on human resource policies and ensures that we have a well-qualified, well-prepared workforce. The Deputy Commissioner for Community Health Services is Bob Hicks. He oversees 35 health districts. We have 119 local health departments organized into 35 local health districts throughout the state. Approximately 75% of the VDH employees work in a local health district or local health department. Fairfax and Arlington health departments are operated by local government, not VDH. Our Director for Public Health Nursing is Janine Utzel. Also reports to Bob Hicks and provides leadership for nurses in our health departments. The Process and Evaluation Function provides operational support to the 35 districts. The group's current project is an operational review of CHS clinical efficiency and effectiveness for VDH STI clinics. Future clinical reviews include planning, immunization, and TB, maternity and refugee programs. This unit includes the Director of Process Evaluation and Oversight and the Billing Administrator. All right. Dr. Norm Oliver is our Deputy Commissioner for Population Health. This area is leading the agency's effort to address Virginia's overall health in a more strategic, all-encompassing way to make Virginia the healthiest state in the nation. Health begins where Virginians live, work, and play. Virginia's plan for well-being lays out the foundation for giving everyone a chance to live a healthy life. The plan highlights specific goals and strategies on which communities can focus so that state can make measurable health improvements by 2020. Oh my goodness. There we go. Dr. Oliver oversees 3 offices. The Office of Family Health Services provides leadership, expertise, and resources that enable Virginians to reach and maintain their optimum health. This office includes over 50 programs that focus on strengthening family and community health, plus risk avoidance tips and information on how certain issues affect public health. Externally, this office is known as VDH Live Well, Virginia's action and source for well-being. He also oversees the Office of Health Equity, which promotes opportunities for all Virginians to live a long, healthy life. The office focuses on improving the health status of underserved, underdeserved, and inappropriately served population and communities, or those at risk for falling into any of those categories through programs, policies, and education, which emphasize community-level factors that influence health. The Office of Epidemiology protects public health through the prevention and control of communicable and environmental-related diseases through disease surveillance and investigation and preventive services. So that's pretty much that piece of it. Anyone who is not a classified employee, full-time classified employee, so that's your wage and contractors, you may leave now. We're about to get into the benefits portion of this meeting. And I'll start that in a second. Hold on for a minute. Here we go. All right, so as you see, this is the benefits question and answers portion. So if you have any questions please chime in or even write the question in the chat box, and I will hopefully be able to answer your questions that you may have. All right, so bear with me. So starting off, we're going to start talking about our medical benefits that's offered through the state. Medical benefits through the state is administered by the Department of Human Resource Management. Yes, if you're away, you're finished with the orientation. Contractors too. So this portion is just for classified full-time employees who are eligible for employee benefits. So the medical benefit options administered by the Department of Human Resource Management, they have several options available. One is the COBRA Care, which is actually Anthem Blue Cross Blue Shields. COBRA Health Aware, which is actually Aetna. We have Kaiser Permanente, and then we have COBRA High Deductible Health Plan that is also through Anthem Blue Cross Blue Shields. And then we have a TRICARE supplement that works with your TRICARE through the military. So those are our options that you have as a state employee. The COBRA Care, COBRA Health Aware, and COBRA High Deductible Health Plan are point-of-service coverages, so you can have that anywhere in the state. The Kaiser Permanente is a HMO, so that's basically in the Northern Virginia area and certain zip codes outside of that area. Kaiser Permanente is not available everywhere. So first thing about your health care, I want to talk about enrollment. As a new hire, you have a 30-day window to enroll into health benefits. So if you are interested in signing up for health insurance coverage for yourself and your eligible dependents, you will have to submit an enrollment form within 30 days to your HR representative in your area. The effective date of that coverage is based on your hire date. So if you are hired on the 10th of February, then your coverage will go into effect the first of the following month. So your coverage will start March 1st. Same thing if you was hired on January 25th, your coverage always starts the first of the following month. So if you started January 25th, your coverage will go into effect February 1st if you submit an enrollment form within that 30-day initial enrollment period.
I just realized it.
We also have other periods that you can enroll or make changes to your plan, which is, we call that our qualified mid-year event periods. So if you have a qualified mid-year event, that will allow you to enroll or change coverage or make changes to your benefits within 60 days of that event. And then the last time that you can make changes or do something different with your health plans is during our annual open enrollment period, which is usually in May, around April or May. We don't have those dates already defined yet, but we'll be notified shortly what the exact dates are. But during open enrollment, you can make universal changes to your health plan. You can add, drop dependents. You can change your plan. You can do pretty much, you can drop coverage, waive coverage, pretty much do whatever you want within the rules during open enrollment. And any changes that occur during your open enrollment period will go into effect the first of the plan year. The first of the plan year, as you see on the screen, starts on July 1st. So the plan year every year for the health coverage is from July 1st through June 30th of every year. That's the plan year. Your benefit options will remain the same within that plan year, but once the next plan year rolls around, there may be changes. So they may or may not be changes to your health benefits. So that's that. Any questions about enrollment? As far as eligibility, as a full-time classified employee, you are eligible to enroll into coverage. So full-time classified, part-time classified employees are eligible to enroll into coverage. If you're a part-time classified employee, depending on how many hours you're working, you may be subject to paying the full premium for the health insurance. But full-time employees, you pay your portion, then the state pays a portion. And then you're also eligible to cover your eligible dependents. Eligible dependents would be your spouse, your children, stepchildren, dependents that you have full sole custody for prior to their age of 18. So you have different, your dependents would have to meet these definitions to be added to your health plan. To add them to your health plan, you would also have to provide some documentation. So you see on the screen, if you were adding your spouse, you would need to provide a copy of your marriage certificate and the first page of your tax return. And you can redact all the financial information. We just need the information showing that you're married filing separately or married filing together. But you would need to provide that marriage certificate and that first page of your tax return. If you're adding your dependent children, your natural children, we just need a proof of birth certificate with your name on it. Stepchildren, same thing. We would need a birth certificate, but also the marriage certificate of the spouse, showing that the spouse is the parent of that stepchild. And then for other child that you have full custody for, we just need that court documentation showing that you have sole custody of that individual. So if you meet those requirements, you can add those dependents to your health plan. Health dependents are eligible to be on your health plan up to age 26, and it's up to the end of the year in which they turn 26. So if someone turns 26 in February, they can still remain on your plan for that whole year until December 31st, and then they will have to come off. If that dependent is a disabled, incapacitated dependent, it's possible for them to continue on your health plan beyond the age of 26, but you would have to get approval to do so. So helping you to make your decision on which plan that you want to go with, there's an online tool available that you can use. It's called Alex. You go to www.myalex.com/COVA/2017. You should be able to go to this website that looks like this on the screen, and then you just go through the module to help you determine what your needs are as far as health care and what would be the best fit for yourself and your family based on your needs. So this is a tool that helps you make your decision on what health plan to go with. You can go with what their recommendation is, or you can go by what your own research has told you to do. So you're not stuck with whatever Alex says. All right, so I have a document that I want to review with you. And it's the Benefits at a Glance document. All right. So this document here gives you an overview of the out-of-pocket expenses that you would have to incur if you selected one of these plans. As you see, we have 4 plans on the screen. The TRICARE supplement is not listed here. If you are interested in the TRICARE supplement, I can provide you with additional information on that. Just send me an email. As far as the Benefits at a Glance document here, I want to go and hit a few points on this document, starting with the first row here. The first row talks about the Health Reimbursement Arrangement Account, or HRA. HRA is only available through your COBRA Health Aware plan, which is really Aetna. Basically what it is, you get money as of your hire date to use towards out-of-pocket expenses for medical prescription drugs or dental reasons. So you have a allotment of money added to your account as of day one of your hire Now, we're in January, so that allotment of money is going to be prorated at this point. Well, we're not in January, we're in February. So that allotment of money is going to be prorated from what you see on the screen. So normally you'll get $600 for the employee, and if you're married, you would get additional $600 for your spouse. But that amount is prorated based on the year that you start with us. So if you're starting with us now, coverage starting effective February 1st or March 1st, those amounts are prorated, and I can give you that proration later. But this is, once your new plan year begins, which the plan year starts in July, you will get a new allotment of $600 for the employee, and if you're married, you get a new allotment of $600 for the spouse. So that's a total of $1,200 that's going to be in an account to be used to pay for out-of-pocket expenses for your medical services that you incur. So that allotment of money can pay for services for yourself and your whole family. So it's not just paying for your spouse or the employee; it's paying for your whole family if you go to the doctor and have services done. This money is not added to is not placed in your hands. It's set up in a separate account for you, and is deducted based through the billing process. If you go to the doctor and you have money available in this account, when you file the claim, that money will automatically be deducted from your HRA account, and you're not exchanging any money out of your pocket at all until that money runs out. Once that money runs out, then you would have to pay your out-of-pocket expenses. So that's the first one. Any questions on that? All right. So the next row that I want to talk about is your deductible. Your deductible has to be met every plan year. So we talked before, the plan year is from July through June. So every plan year you have to meet your deductible requirement based on the plan that you're in. And based on meeting your deductible requirement, after you met your deductible requirement, then your plan will pay towards any claims after that point. So, but initially, you have to exhaust your deductible amount before your plan will pay anything towards your claims. So if you're in a COBRA Care plan through Anthem and you're the only person on your plan, your deductible is $300. So, you'll have to pay out of pocket $300 for that plan year. Once you've paid $300 out of pocket for that plan year, then your plan will pay a percentage toward any future claims after that point. All right. And that's, the same is for these other plans. So the deductible for the Aetna one is $1,500 for a single person. Deductible for the COBRA High deductible plan is $1,700, and there's no deductible requirement for your Kaiser. So based on having one person, based on having two or more, you have to exhaust that deductible amount before your plan will pay percentages towards your medical claims. There's also an out-of-pocket expense limit, and you have to meet that every plan year as well. So the out-of-pocket expense limit is basically the amount that you would pay out-of-pocket before your plan will pay 100% of the plan, 100% of the claim moving forward. So if you, the out-of-pocket expense limit is the amount that you will pay out-of-pocket for that plan year, the most that you'll pay out-of-pocket for that plan year for medical services. So that's, if you're enrolling into the COBRA plan with Anthem for one person, once you paid out of pocket the $1,500, then your plan will pick up the claims after that point at 100%. Doctor's visits, we have co-pays for your Anthem plan, and then the other co-pays for Anthem and co-pays for your Kaiser plan. You pay a certain amount to see a specialist, a certain amount to see a primary care doctor. These have to be network doctors, so they have to be within the plan's network. The other two, the Aetna plan, the Cobra Health Aware, and the Cobra High Deductible Health Plan, you pay a percentage of the claim once you've met your deductible amount. So once you've met your deductible amount, you're responsible for 20% of the claim, and then your insurance will pay 80% of the claim. Okay. I'm going to move on down to prescription drugs. So prescription drugs, we have a retail pharmacy and a home delivery pharmacy option for prescription drugs. If you're looking at this Anthem plan, it has a tier program. A tier program is basically what this is. So if you see the $15, that's tier 1, which covers your generic drugs. Your $30 is your tier 2, which covers your mid-brand drugs. Tier 3 is $45 for a 34-day supply. That's your name brand drugs. And Tier 4 is $55 for a 34-day supply, and that's for your specialty drugs. Now, this is a mandatory generic drug program, so if there's a generic available, you have to get the generic. The only way you can go up to a higher tier is if there's no generic available, then you have to go to a higher tier option, either your mid-brand drug or your name brand drug, depending on which one's available. But it's a mandatory generic drug program. If you get the generic drugs, the cost you see on the screen is what you would pay. If you decide to get a name brand drug when there's a generic available, you'll be subject to paying the difference in the cost. So your plan is not going to cover that drug purchase at the highest level if you go with a name brand drug when there's a generic available. Same thing for the home pharmacy, but that's this is for a 90-day supply, and that is going to be delivered to your home directly. That's for Anthem. For your Aetna plan, there's a copay based on you have to meet your deductible first. Once you met your deductible, then you are responsible for 20% of the total cost for that drug, and your plan will pay 80% of that. Same with your Cobra High Deductible Health Plan, and then Kaiser has tiers as well. So I'm going to move to the next page. And this document is available online. I'm going to send you guys links to all these places here. You can pretty much get these links when I send out the email of who attended this meeting here. But on the second page of this Benefits at a Glance talks about your wellness and preventive services. So you have the opportunity to seek services once a year, and that's like your annual checkup. You can seek these searches once a year at zero cost to you. It has to be once a year, though. So if I have some services done today, I can't come back until at this date next year. So I can't come back until February 14, 2019 to do an annual checkup. You may need to tell your doctor this is your annual checkup, because if they don't know, they may not bill it correctly. Because if it's an annual checkup, you shouldn't have any money exchanging hands. You shouldn't have to pay any copay or anything. So you have to communicate that this is my annual checkup with your doctor to ensure that they bill it correctly. The plans that we offer we have a dental piece of this plan, which is a basic dental, which is covers only your diagnostic and preventive coverage. But we also have buy-ups with these plans. We have a buy-up for dental. We have a buy-up for vision. We have a buy-up for hearing. And then we have an out-of-network buy-up. Now, the dental buy-up will cover the 2 cleanings per year, the diagnostic and preventive services like the basic dental would. but it will also cover you for more extensive work, like more complex work like implants, crowns, dentures, bridge work, orthodontic work, root canals, things like that. The basic dental pretty much only covers your 2 cleanings per year. So if you need anything more than that, you may have to purchase the expanded dental buy-up that will cover you more extensively when it comes to your dental services. The expanded dental also has a deductible that has to be met. The deductible for single coverage is $50. If you're the only one on the plan, you would have to exhaust a $50 deductible. 2 people on the plan is a $100 deductible, and then 3 or more individuals on the plan, that's a family plan, that's a $150 deductible that you have to exhaust before your plan will kick in and pay its percentage. For orthodontics, there's a lifetime maximum benefit of $2,000 for that orthodontic services per covered individual. So that's your expanded dental. We have vision, which covers your routine eye exams once a year. It covers glasses and frames. If you want vision, you would have to select that buy-up if you want coverage in that area of the eye exam, lenses, and frames. We have routine hearing, which covers for hearing exams once a year, and then covers for hearing aids and other devices once every 4 to 8 months. And then we have your out-of-network option that covers you if you go to a doctor that's not in your network. So, all these plans, you have to stay within your network and go to a doctor that accepts that plan. If you had the out-of-network option, that covers you if you went to a doctor that's not included in that network, because if you did not have the out-of-network option purchased, then if you went to a doctor that's not in the network, you would not be covered at all for that visit. So by having the out-of-network option available to you, if you happen to go to a doctor that's not in the network, you will be covered, but that coverage will be reduced based on the normal payout that the plan will provide. And also, if you're a doctor that you go to that is not in the network, they don't have any kind of agreement with your plan to determine what to charge for a particular service. So, a network doctor would know to charge a certain amount for a broken arm or whatever. But if you go to a doctor that's out of network, they can pretty much charge whatever they want, but your plan is only going to pay 25% less than what they think the cost should be. So you may be subject to paying a little bit more if you went to an out-of-network doctor, but it's good to have that coverage to make sure that something is paid towards that claim. Okay. And like I said, if y'all have any questions, y'all can unmute yourself and just chime in, and we'll try to answer your questions. All right, so that's that document. I'm gonna pull up the premiums so you can see that right now. So the healthcare premiums. Now these premiums are only good through June 30th, 2018. That's the end of this plan year that we're in. Like I said, every plan year things could change. So effective July 1st, 2018, the rates could be different. But as of right now, these are the rates based on the plans that we offer. If you look at the rates on the left that's highlighted in orange, that is your full premiums that you would pay minus without having any kind of reduction or premium reward added to it. And I'll talk about premium reward in a second. But as far as your premiums here, your COBRA Care plan, that's your basic COBRA Care plan. And we saw on the other page that, CoverCare was your Anthem plan. So CoverCare, and then we have CoverCare Out of Network, CoverCare Expanded Dental, CoverCare Out of Network and Expanded Dental, CoverCare Expanded Dental Vision Hearing, CoverCare Out of Network, Expanded Dental Vision Hearing. That's all your CoverCare plans through Anthem. So if you look at what the employee pays the top figure. So the bolded top figure is what the employee pays. The state pays the figure below that, and the total premium is the combination of the two. So if you're covering only yourself under the basic CoverCare plan, your coverage would cost you $88 per month. So keep in mind, we get paid twice a month, so that's going to be broken down to $44 every paycheck. So if you start your coverage on February 1st because you were hired in January, then your first deduction for the month of February should come out in the middle of February, which is February 16th. That's the first portion of February. So that $44 should come out, and then the next check that we'll get on March 1st will cover the remaining portion of the premium for the month of February. So the monthly premiums that you see here is broken down into two payments, the 1st and the 16th. As far as for you only, Employee Plus One, the premiums get a little bit more expensive, like covering you yourself and one dependent. Doesn't matter if it's a spouse or a child. You plus two or more, that's your family coverage rate. Now, your premium rewards is basically a reduction in your health premiums if you do a requirement. So there's a requirement to obtain a premium reward of going online and doing a health assessment. So you have to log into a website, My Active Health, and complete a health assessment. Once that health assessment is completed, you will be eligible for a premium reward based on the schedule. So there's a schedule for that premium reward as far as when it's going to go into effect based on when you complete your health assessment. And I'm going to pull up that document in a minute. But that's the difference in the sections here. The orange section is your premiums without rewards. The section in blue is your premiums with the reward, so with the discount. The document that I was referring to about premium reward is this document here, which is premium reward requirement. So to get the premium reward, first off, you have to go to the website that's shown on the screen, www.myactivehealth.com/COVA. If you go to that website, you will see a health assessment on there. Once you register and log into that website, you will see a health assessment that you can complete. Upon your completion, then that starts your eligibility for the premium reward. Now, yourself and your spouse can log into this website and register and complete that health assessment. So if you're just doing the health assessment yourself, then you're getting the $17 reduction. If your spouse does the health assessment as well, there will be a $34 reduction. All right, somebody had a question. I'm trying to find that. All right, so do you have to meet the deductible to get 2 dental cleanings per year without paying, or is it included in the plan? The dental cleanings are covered. So 2 cleanings per year is offered. You don't have to meet any kind of deductible for your cleanings per year. Does the spouse have to create their own login for health rewards? Yes. The spouse would have to create their own login using your ID number, because you're using your employee ID number to register. So your spouse will also have to use your employee ID number as well. But yes, you both would have to set up separate separate logins for that My Active Health website to be eligible to get credit for premium rewards for you both. Now, your premium reward, based on the date that you complete that health assessment, it will go into effect down the road. So we're at February 14th right now, so we're within this window of January 16th through February 15th. If you did the health assessment within that time frame, your premium reward will go into effect April 1st. If you miss this window, then your premium reward will go into effect May 1st. So it's based on the date that you complete your health assessment. It's whether you're getting the premium reward or not, when you get the premium reward or not. All right. So I think that we're good on that. Let's go back. All right, so moving right along to our flexible spending accounts. We have flexible spending accounts here at the Commonwealth. We have a medical flexible spending account. We have a dependent care flexible spending account. Basically what they are, they allow you to set up a account to pay for medical expenses or dependent care expenses. So this flexible spending account is only available to you every plan year. You have to enroll every plan year if you want to participate in a flexible spending account. But you are eligible as of right now, as of your initial enrollment, you're eligible to start participating with a flexible spending account. To go into it will go into effect the first date of the month that you're eligible for coverage. So if your employment started in January, then your coverage will start February 1st. If your employment started in February, then your coverage will start March 1st. So it starts from your coverage date through the end of June. So any expenses that you incur, either medical or dependent care, from your start date to the end of June is eligible for reimbursement. Basically how this plan works, you have to add in your account the amount that you want to the amount of your expenses that you will incur between now and the end of the plan year, which is June 30th. So if you have a medical expense account and you have medical expenses starting March through June, you have to identify what those are, and you can set up a medical reimbursement account, and you can put into that account up to $2,600. And you can have that set up so that amount will come out of each paycheck between now and the end of the year, end of the plan year, and then you can file for reimbursement for any expenses that you may incur during that period of time. So if I had to buy some glasses and my glasses cost $600, I could divide $600 by the number of pay periods between March and the end of the plan year, and that's the amount that will come out of each check. I will get a Visa card to pay for those glasses, so I could pay as of day one of my eligibility using a Visa card for my $600 glasses, and then the deductions that will come out of each paycheck will capture the $600 that you put into that account over that March through June period of time. Same thing for dependent care, but that's for daycare services. Now, dependent care is not available to children age 13 or above, or expense for only the expense account is only for children age 13 and below. That's what I'm trying to say. You can cover disabled parents or spouses if they have to attend like an adult daycare or something. That is also covered. So that's your flexible spending account. We also have special programs. We have Healthy Beginnings, which is a maternity support program. By participating in that program, you can get $300 copay waived I hear a child. Can somebody mute their phone, if you don't mind? We have Healthy Insights. That's for personalized support for health condition management. So if you had a health condition like diabetes, hypertension, things like that, they will help you manage those conditions. We have Healthy Lifestyles, which is a stress management, weight loss, smoking cessation program that helps you live a healthy lifestyle. We have online doctors that if you didn't want to go to the doctor, you can do it online based on the plan that you're enrolled in. And then we have My Active Health. That's the same site I referred you to about the premium rewards. That's basically an online wellness website that will help you get the tools that you need to live a healthy lifestyle. Any questions about the health insurance side of things? We're about to jump into retirement. All right. I'm going to move right on. So we have 3 plans available for retirement, and these plans are all through the Virginia Retirement System. That does our retirement coverage. Your plan that you're in is based on these rules. So if you're in Plan 1, that means you became a member prior to July 1st, 2010, and you had 5 years of service as of January 1, 2013. So if you're a rehire, it's possible that you're in VRS Plan 1. If you're in VRS Plan 2, you became a member of VRS after July 1, 2010, and you did not have 5 years as of January 1, 2013. That means you're in VRS Plan 2. All of our new people hired after January 1, 2014, or if they took a refund and now they're hired after January 1, 2014, they're enrolled into our VRS Hybrid Retirement Plan. So based on those rules, that's the retirement plan that you fall under. Your VRS Hybrid Plan is the only plan I'm going to really discuss. And the VRS Hybrid Plan, if you want to discuss the other plan options, we can talk offline. The VRS Hybrid Plan has 2 components to it. It has a defined benefit component, and it has a defined contributions component. Now, your responsibility in your retirement is to contribute at least 5% of your salary towards retirement every month. So 4% of that salary is going to your defined benefit portion of your retirement. So that defined benefit portion of your retirement is going to give you a monthly benefit that is based on a retirement formula. That monthly benefit that's based on a retirement formula will give you a check every month for your lifetime. So the defined benefit portion gives you a check every month for your lifetime if once you're eligible to retire. The other component of the hybrid retirement plan is the defined contributions component, which is based on contributions and investment options that you're selecting. So there's a 1% that goes, based on your salary, goes towards your defined contributions component. You're also able to contribute additional amounts to that side of the retirement plan if you choose to do so. All right. So we also have a supplemental retirement option called deferred compensation. So if you want to contribute additional monies out of your paycheck and it go towards a deferred compensation plan, the benefit of it is you're saving additionally for retirement. So you'll have your VRS retirement benefit, plus you have this deferred compensation retirement benefit on the side that you're building up over the years of your employment. The benefit of it is also that it's a tax-deferred deduction. So anything that you put into this account will be reducing your taxable income, which would make you look like you're earning less than what you actually are, plus you're saving towards retirement for the future. There's a pre-tax option, and there's a after-tax option available through your 457 deferred compensation. Whichever one that you're interested in, you can sign up for. Life insurance. Everyone gets life insurance. As a full-time employee, your life insurance is 2 times your salary, so whatever your salary is, round up to the highest 1,000, multiplied by 2. That's your total life insurance coverage. That basic life insurance coverage is only covering you as the employee. You do have options to purchase additional life insurance, and that's called our optional life insurance coverage. So you can purchase optional life insurance in addition to the basic that you already have. So you already have 2 times your salary. You can go with option 1, which is 1 times your salary, in addition to the 2 times your salary that you already have. You can go with option 2, which is 2 times your salary in addition to the 2 times the salary that you have to the basic life insurance. You can go with option 3, 3 times your salary in addition. You can go with option 4, which is 4 times your salary in addition. Now, the optional life insurance also covers your spouse and dependents if you choose to do so. So you can cover yourself with additional coverage, you can cover your spouse with additional coverage, and you can cover your children with additional coverage. To enroll, you have to fill out a optional life insurance enrollment form within 31 days of your hire to be guaranteed issue for yourself. Dependents may have to fill out a evidence of insurability form that will have to be submitted to the life insurance carrier, which is called Minnesota Life. And if everything's fine, once you submit that evidence of insurability form, then your coverage will also still be available. So that's your optional life insurance. So the extra HR representative for a optional life enrollment form if you are interested in signing up for this. This is not a benefit that you get enrolled in automatically, so you have to ask for the form and actually enroll into this coverage. The cost for your coverage is based on your age. So on the screen it shows you the rate per 1,000 based on your age. So there's a rate based on your age, your spouse's age, and then there's a flat amount that's paid based on covering your dependents, based on the option that you go with. There is a calculator that will help you determine what that cost would be for you if you wanted to participate in the optional life insurance benefit. You just have to go to lifebenefits.com/plan-design/Virginia, and there's a calculator out there that you can run the numbers to see what that cost would be if you are interested in enrolling in the optional life insurance coverage. I would like to say the basic life insurance is at no cost to you at this time. You don't pay anything for the basic life insurance, but you will be paying out of pocket if you sign up for the optional life insurance. Leave. Well, before we get to leave, any questions about the optional life, retirement, or anything? All right, leave. I'm going to talk about annual leave. Annual leave is basically our vacation time. So we accrue annual leave every pay period. So we have to work a full pay period before you'll get your annual leave accrual. Our pay periods run from the 25th through the 9th, and then that's one pay period, and the other pay period is the 10th through the 24th. So if you work a full pay period, you should be earning annual leave hours that can be used towards your vacation time or just personal time that you can take. And your accrual is based on your years of state service. So it's not based on your VRS service. It's based on your years of state service. So if you were employed with the state previously, you will get credit for that time. So if you have less than 5 years of state service, then your accrual every pay period would be 4 hours of annual leave every pay period. You had 5 to 9 years of service is 5 hours. 10 to 14 is 6 hours. 15 to 19 is 7 hours. And you see where I'm going with this. So that's your annual leave. Annual leave can be taken with approval from your supervisor. So you just can't take annual leave whenever you want to. You have to submit annual leave requests by filling out a leave activity form, and your supervisor will have to sign off that you are able to take that annual leave time. Sick leave is basically time away due to being out sick. I have a question. Does state service include only full-time classified employment? Yes, it's only full-time classified, so we're not counting any wage employment that you may have had or contractor employment that you may have had. We're only counting your full-time classified employment. Full-time or part-time classified employment is what we're considering when we determine your leave accrual. Sick leave. You get sick leave as of day one of your hire. You get sick leave as of day one of your hire. The sick leave amount that you get is based on your months of career state service as well. So if you have less than 60 months, your sick leave coverage should be 64 hours. So you should get 64 hours as of day one of your hire date to be used for sick leave reasons. So sick leave reasons would be if you're out sick due to a cold or something, you have medical appointments, if you're out, if you're sick days, you may have to provide doctor's notes to your supervisors if you're out for 3 or more days. But generally, if you're out with a cold or something, you can use a sick day for that. If you need to go to the doctor for an appointment, dental appointment, whatever type of medical appointment, you can use sick leave to cover that absence. Once again, your accrual is based on your career state service. So 60 to 119 months, you would get 72 hours of sick leave, and then 120 or more months of state service, you'll get 80 hours of sick leave. Now, you get sick leave as of day one, and then when the next leave year begins, you get another allotment of sick leave. So it's not an allotment that's going to add to your balance. It's going to be another 64 hours to use for that particular year. So the leave year begins on January 10th. So you have 64 hours if you're brand new. You have 64 hours to use between now and January 10th of next year. January 10th of next year, you'll get a new allotment of 64 hours to use for that following year. All right. You also get, as of day one, family personal leave. So family personal leave can be used for family reasons. It can be used for personal reasons. But you'll get an allotment as of day one of your hire for family personal leave, which is 32 hours. So you would have to get approval before using that leave from your supervisor. I have a question. Can sick leave be used for an ill child as well? Not sick personal. Your family personal would be used for a sick child. So you have family and personal leave to use for a family member. The sick leave is for your personal absence. So that's sick personal. Sick leave personal, and this is family and personal leave. So you can use it for family-related reasons or personal reasons. All right, so you also get that amount of family personal leave as of day one of your hire, so you should have a balance of 32 hours of family personal leave as of your hire date. Okay, we have another leave type, which is called civil and work-related leave, and that's pretty much like administrative leave to, attend different covered functions, going on state interviews, attending meetings with the state, but you also can use it for these following reasons. You can use it for if you're summoned to serve on a jury duty. You can use it to appear as a crime victim or witness in court proceedings. You can use it to accompany a minor child when the child is legally required to appear in court, serve as an officer of election, serve as a member of a state council or board, and to attend his or her own naturalization ceremony. There's more reasons that you can use this, but this type of leave is a leave that is not charged from your account. But to use this leave, you have to get approval from your supervisor as well as your HR. They have to review the circumstances for taking this type of leave to make sure it is in line with the policy. So that's civil and work-related leave. We also have school assistance and voluntary services leave, which provides 16 hours of paid leave each leave year for either a volunteer service, like volunteering with the Red Cross or something like that, or through authorized school assistance. So if you're going to assist your child at school, and this is only for grade up to grade 12, so it's not for college. But if you're going to assist your child at school, you can use 16 hours in total for either school assistance or voluntary services reasons. So that's 16 in total, not 16 apiece. So you can only use that 16 hours once a leave year. We have family and medical leave, which provides 12 weeks or 480 hours of unpaid leave due to a personal illness or due to an illness of an immediate family member. Family medical leave is basically covering your job, providing you job protection for that period once you meet eligibility. So you're not eligible for family medical leave until you've been with the state employer for 12 months over the past 7 years, and you would have to work at least 1,250 hours in the 12 months prior to your family medical leave request. So you have to meet the requirement first to be eligible for family medical leave. Once you are eligible, you are provided job protection, so we can't fill your position if you had to go out due to a family medical leave covered illness. Now, family medical leave would have to be certified by the appropriate doctor to prove that this person is out due to this illness, or if you're caring for a family member that you're assisting with caring for that family member, it has to be certified. And you can have unpaid or paid family medical leave. If it's paid, that means you're using your own leave balances to keep you on the payroll. If it's unpaid, it'll be leave without pay. You can also take family medical leave continuously, so you can take the full 12 weeks continuously, or you can take family medical leave intermittently, so you can take a day here, a day there once you're approved to take that time. That's family medical leave. We have leave without pay, and we have leave without pay if it's less than 14 days. It's just considered a docking. So if you're out and you don't have leave to cover your absence, we'll have to dock you. So that'll be leave without pay. If you have a leave without pay period that's greater than 14 consecutive days, then you're considered to be on an extended leave without pay, which could affect your benefits like your health insurance and your retirement contributions and things like that, if you fall into that category. We have disability insurance here through the Virginia Sickness and Disability Program. So that's our disability carrier, which you would be working with a third-party administrator if you had to go out on a disability. Now, you're not covered under our disability program until you've been with us for 1 year. So you have to be with us for 1 year. You're not eligible to go out on short-term disability for a personal reason within 1 year of your employment. So after 1 year, you're eligible. But within 1 year, you're not eligible. The only way that you're eligible to go out on a short-term disability within 1 year of your employment is if it's a work-related disability. And that's the only way you can be covered for short-term disability. Basically what it is provides income replacement for the period of approved disability. And there's two types of disability. We have short-term and we have long-term. Short-term disability is for a total period of 125 days. So you can be receiving income replacement if you're out due to a approved short-term disability for 125 days. Once that 125 days has expired, then you will transition, and if you're still out, then you would transition to long-term disability. Your income replacement for the first 5 years of your employment, if you go out on a short-term disability, will be based on a 60% income replacement. So it will be 60% of your salary that will be paid to you if you're approved for a short-term disability period within 5 years of your employment with us. But once you've been here for 5 years or more, then your income replacement is based on your years of service and starts off at 100% income replacement, then reduces down to 80% income replacement, and then ultimately reduces down to 60% income replacement. But the total period is still 125 days. So that's short-term disability. If you're that first year that you're not eligible, I would suggest that you purchase your own disability coverage, because you never know what can happen. You can have an accident today or tomorrow and require some kind of income. If you don't have a disability plan that you know outside of what we offer, then you're not going to be covered. So you may run into a leave without pay period, and you're not able to maintain your bills if you're not covered with a disability plan from somewhere, like an AFLAC or somewhere like that. We have long-term disability, which also gives you income replacement. Your income replacement in long-term disability would be 60%. But once you hit long-term disability, not working, then you're technically separated from this employer, but you're still considered a state employee because you still would be receiving benefits as far as your retirement. So if you're out on long-term disability, you still receive service credit for your retirement during that period of time that you're on long-term disability, but you're not considered an employee. And if you wanted to return to your job, you would have to basically reapply. Got a question. What about health insurance and VRS contributions when on short-term disability? So health insurance and VRS contributions continue during short-term disability. So everything remains the same during the short-term disability period, that 125 days. But once you transition to long-term disability, things will change. So the health care will be the same, but your health care costs will increase because you'll be paying the retiree rate for health insurance, which does not include the state portion that the active employee health insurance includes. So you're paying around $700 for one person if you're transitioning into long-term disability versus paying that $88 for the basic COVID care if you are still within your short-term disability period. So short-term disability, everything will remain the same as if you're actively working, but once you transition to long-term disability, then things will change. All right. Employment policies and procedures are just a few of them that I'm going to go over. There are several policies out there that you can review. If you go to the Department of Human Resource Management website, all the state policies are out there, Department of Human Resource Management. The first policy I'm going to talk about is the outside employment policy. So if you're working outside of BDH in any kind of capacity, even if you're an Uber driver, we need to know there's a form that you would need to complete, and then the chain of command would need to approve. So your supervisor all the way up to your director needs to approve that. Once it's approved, then you're good to go. But if you don't have that and we find out that you work somewhere that conflicts with the agency, then you may be subject to termination. If you go on long-term, and I have a question, if you go on long-term and reapply, will you get your job back? That depends. If your job is not filled already, because we can fill your job while you're on long-term disability, so you may not be well enough to return, and then if we fill your job, then that job is filled. But if you're qualified, you apply, and you get the job, it's possible that you can return from a long-term disability to the same job if that job is still available. But if the job is filled, you can apply for other jobs. we will, if you're qualified, we would consider you, but it's not a guarantee reemployment with us. Sorry. So that's outside employment probationary period. You have a 12-month probationary period if you're a new hire or a 12-month rehire. So we can terminate you for any particular reason during the probationary period. You usually get a 6-month evaluation to see how you're doing in your job, but you're having to serve a probationary period upon your employment or reemployment to the state. And then we have the employee work profile. And the employee work profile is basically the document that has your job description on it. So it should lay out what your role and responsibilities are. So I suggest sitting down with your immediate supervisors to make sure that you're clear about your expectations so you can be successful in your position. If you haven't seen your employee work profile yet, make sure you make that top on your priority to see what your roles and responsibilities are, because like I said, you're in a probationary period. If you're not doing what your employee work profile says you're supposed to be doing, you could be subject to termination within the 12-month probationary period. And that's my spiel for today. Do I have any other questions or comments before we sign off today? So I have a question. If you are adding a spouse in July, then would you have to wait until the next year after you file your taxes to be able to add your spouse? So are you talking about getting married, or are you talking about you're already married? If you're already married, you should have your most recent getting married. So if you're getting married, then if you haven't filed your taxes yet, we would just need your marriage certificate. So if you just got married and you haven't filed your taxes yet, we would just need your marriage certificate. But we could ask for additional documents, but usually we just ask for the marriage certificate because you haven't filed taxes together as of yet. So that could be a way you wouldn't have to provide that document. Any other questions? Again, my email's on the screen. I intend to send you a follow-up email with the links to the website that I think are important and the link to that VDH overview video. But if you don't see that from me, because I told you I'm having technical difficulties, or it might be my issues with this WebEx that I can't manipulate it the way I want to yet, but I'm getting there, so I'm trying to, after this meeting, I'm going to pull your names. If I can't get to your names, then I would need you to email me to make sure that you get those links. I will send them to you today. If you don't get that email today, then send me a link tomorrow and let me know that you was on this call today and that you want those links, and I will send it out to you pronto. Thank you guys for attending today. If you have not already registered on Train for this training, make sure you do so. If you haven't, email me to let me know that you completed this training so I can make sure that the appropriate people update your training record once you get access to it. Otherwise, thank you guys. Welcome to VDH, and God bless you.